My name's Dabrow Woods, and I'm the Chief Nurse of Walters Clore Health. And today I'm here to talk to you about evidence-based practice, what it is, what it isn't, why it makes a difference, and why it is so crucial to what's going on in healthcare today. So what is the top global challenge that faces everyone, no matter where you are, if you're in the United States, if you're in Australia, if you're in Europe? Everyone faces the same challenge in healthcare today, and that is to provide the evidence-based, cost-effective, quality care that will improve practice and improve patient outcomes. That is the #1 challenge faced by all healthcare providers and healthcare institutions today. Why is this such an issue? Only 20% of what we do as healthcare providers is based on evidence. That means 80% of what we do is not based on evidence. And only 55% of the time, patients get the evidence-based recommendations to base their treatment. That means the remainder of the time, they are not getting the latest standard of care. The other thing that's really important to consider here is it takes 15 to 20 years to get evidence into practice, and that's simply way too long. What this all means is our patients are not getting the care that they deserve. So what is the solution? The solution is to integrate evidence into practice to improve patient outcomes, and the true overall solution is the Joanna Briggs Institute. So let's talk about a little bit about the beginning of evidence-based practice. Well, evidence-based practice really started back in the 1970s with Archie Cochrane, who was an epidemiologist out of the United Kingdom. And he took a look at the way healthcare was being delivered in that country, and what he realized is that patients were dying. They were not getting the quality of care that they needed. So he decided to look at a study where he took two groups. One group were people who got care the way it's always been delivered, and the other group was looking at patients who got care that was based on evidence. And what he found is that patients who got the care that was based on the evidence had better outcomes, the practice was better, and it saved the healthcare institutions money. So from that time of the 70s with Archie Cochrane, McMaster's University in Canada has really developed what we consider evidence-based practice today. And now the overarching definition of evidence-based practice is taking external evidence. And this is the evidence from systematic reviews, randomized controlled trials, best practice, clinical practice guidelines, and pairing that with what we call internal evidence. And that is the evidence that we get from our clinical expertise of being in healthcare as healthcare providers for a very long time. But it doesn't stop there, and this is a key point to remember. It also combines what the patient wants, what their values are. And that's a really key point, because if the patient does not want the type of care that we are recommending to them, then that care cannot be instituted. So evidence-based practice is combining the best research evidence with clinical expertise with patient preference. Doing all those things will improve practice and improve patient outcomes.